Welcome to Center for Behavioral Health. If you're watching this video, it means that you've taken the first step on the road to recovery. Congratulations! We're excited to help you get started on this journey. Center for Behavioral Health is a network of private, outpatient clinics offering medication-assisted treatment for opioid dependency. Each of our locations are staffed with highly qualified physicians, pharmacists, nurses, and counselors. Our goal will be to individualize your treatment to meet your specific needs. For many of you, this may be your first time in treatment. This video will help you to understand what to expect from the treatment process. Let's start by talking about the medications. Methadone is a long-acting opioid medication. It has been used in treatment since the 1960s and is widely considered the most effective treatment available for opioid dependence. A stable dose of methadone taken once a day will eliminate withdrawal symptoms and cravings for a full 24 hours. Methadone at a stable dose will not create feelings of euphoria or sedation and will block the effects of other opioid drugs taken while in treatment. Despite all the research about methadone, there is still a lot of misunderstanding about methadone treatment. Some people worry that they are just replacing one drug for another. In actuality, methadone is a medication used to correct the withdrawal syndrome you've developed as a result of your opioid dependence. This could be compared to how a diabetic depends on medications to correct insulin deficiencies in their body. Methadone will not cure you of your opioid dependence, but it will correct the physical symptoms and put an end to the stressful and sometimes destructive behaviors and problems that have happened as a result of your opioid dependence. Another medication we use at Center for Behavioral Health to treat opioid dependence is Suboxone. Like methadone, Suboxone will eliminate withdrawal symptoms and cravings and block the effects of continued opioid use. Suboxone has also been shown to be highly effective in treating opioid dependency. It is important for you to know that there are other treatment options available for opioid dependence. Vivitrol is another medication we use at Center for Behavioral Health. When used for opioid dependence, patients must be abstinent from opioids for a period of time prior to starting Vivitrol. Other treatments not offered at Center for Behavioral Health include inpatient hospitalizations or detox programs. Feel free to talk to us if you have any questions about other treatments. Although the staff at Center for Behavioral Health may have a recommendation on which treatment and medication may best fit your needs, the decision about treatment is yours. Prior to starting any medication, you will be asked to give your written consent to treat you with a prescribed medication. Please let us know if you have any questions about your consent for treatment. As with any medication, methadone and Suboxone can have side effects. Some common side effects with methadone are constipation and sweating. Some patients have also experienced decreased sexual desire and drowsiness. Suboxone can cause constipation and sweating, as well as headaches and sleep difficulties. Most side effects occur in the early phases of treatment and subside quickly. However, if you continue to have side effects, talk to your treatment team at Center for Behavioral Health about possible solutions. In addition to medication, you will also be required to attend counseling as part of your treatment. Your counselor will be the primary person responsible for coordinating your services. Counseling is an opportunity to address the issues that brought you into treatment. Counselors can assist you to build new skills to prevent relapse and stop problematic behaviors. You are welcome to include your family, friends, or loved ones in your counseling. Counselors can also assist you with getting connected to other resources in the community, such as support groups, medical or mental health services, housing needs, and so forth. Talk to your counselor if you feel you may benefit from a referral to outside services. Your counselor will also assist you in the development of your treatment plan. Your treatment plan is a written outline of goals and objectives you'd like to achieve through your involvement in the program. It will include input from yourself, your support system, and your treatment team at Center for Behavioral Health. It will incorporate your needs and preferences as well as your abilities and strengths. Your treatment plan will be reviewed with you on a regular basis throughout your time in treatment. We understand that the idea of talking to someone about your problems can be uncomfortable, so we make sure that your treatment here is both private and confidential. Counseling sessions are conducted in private offices, and the medication windows are also designed to provide privacy. In addition to privacy, we also ensure confidentiality. That means that we cannot reveal any information you disclose to us or information about your treatment without your written consent. Records of your treatment are kept in locked filing cabinets and are not accessible to anyone other than Center for Behavioral Health staff. Now, there are some limits to confidentiality, and we want to be sure that you know what they are. One exception is medical emergencies. If you have a medical emergency at the clinic, we will provide limited information to healthcare providers to ensure you are taken care of. If you tell us that you may harm yourself or someone else, we will also do what is necessary to ensure the safety of you or the other person. As healthcare providers, we are mandated reporters of child abuse and neglect. Suspected abuse of a child or elderly person will be reported to the appropriate authorities. If you commit a crime on Center for Behavioral Health premises, this is not protected by confidentiality and can be reported to the authorities. Records of treatment can be released if required by a court order. We will also be required to release certain information for the purposes of audits or inspections, or as agreed upon within a Qualified Service Organizational Agreement. A Qualified Service Organizational Agreement, or QSOA for short, is a written agreement that Center for Behavioral Health has with another medication-assisted treatment program to ensure that you as a patient receive care if a disaster occurred and the clinic was unable to open or was inaccessible. The QSOA for your specific location will be posted at the clinic. You can also ask a staff person about the QSOA for your location. Now let's talk about some of the procedures for taking your medication. When you come to the clinic for dosing, you will be required to check in at the front desk prior to going down to the medication window. The person at the desk will notify you of any payment due or of any messages or flags from your counselor. Once you have checked in and a medication window is available, you can go to the window for dosing. Both methadone and Suboxone should be taken at the exact frequency prescribed. Taking your medication at the same time every day can help you to achieve optimal stability. At the dosing window, you will be required to remove any sunglasses and to be off of your cell phone. Drinks or empty drink containers should not be brought to the window. The nurse will ask you to state your name and dose amount for verification. You may also be asked to show ID. You will then be asked to sign for your medication, after which the nurse will hand you your medication. For methadone patients, your medication will be in the form of a liquid. The nurse will watch you take your medication and verify that you have ingested it. For Suboxone patients, medication will be in the form of either a sublingual tablet or sublingual film strip, which you will place under your tongue. Nursing will observe that you have placed it correctly and that the medication has been absorbed. Do not eat, drink, or smoke, and avoid talking while the medication is absorbing. If you miss a day or two of dosing, the nursing staff may have to check your vitals and assess you when you return. Missing 3 days or more may require a dose adjustment. If you miss 7 or more days, you may be required to see the physician on the next available appointment day in order to continue dosing. For locations that are closed on Sundays, you must attend the clinic at least 4 days during the week in order to be eligible for a Sunday take-home dose. When you first enter treatment, one of our first goals will be to get you to a comfortable and therapeutic dose. You will start on a lower dose and then be gradually increased. Once your dose stops increasing, the levels of medication in your system will continue to increase for several days. Continued use of other opioids during the induction phase can make it difficult for the staff to assess your dosing needs and can place you at risk for overmedication or overdose. Signs of a methadone or Suboxone overdose include extreme drowsiness, pinpoint pupils, weak or shallow breathing, and disorientation. If you suspect that you or someone you know may be experiencing an overdose, seek immediate emergency medical attention. Once you've been coming to the clinic for a while, you may be eligible to start taking some of your medication home with you. We call these take-home doses, or take-homes for short. The federal and state government give us guidelines on how long a patient must be in treatment before they can receive take-home doses and how many take-home doses they can receive. They also give us criteria that patients must meet in order to be given take-home medication. Some of these criteria include the absence of recent drug or alcohol abuse, regularity of clinic attendance, absence of criminal activities, stability of home and social environments, length of time in treatment, assurance that the medication will be safely stored, and whether the benefits of reducing clinic attendance outweigh the risks for diversion. Diversion in this case means the use of medication for means other than for what it was prescribed. This could include taking more medication than prescribed or giving or selling the medication to somebody else. It is important for you to understand that giving or selling your medication to someone else can be extremely dangerous. If methadone or Suboxone is given to someone not tolerant to opioids or to a child, it can be extremely dangerous and potentially fatal. Because of these risks, it is also important that you store your medication appropriately in your home. Take-home doses should be stored in a locked container, should be inaccessible to others, and should be out of the reach of children. Medication should be kept at room temperature. Do not store your medication in extreme heat, such as in a car or near a light, or extreme cold, such as in the refrigerator. In order to protect against some of these risks, Center for Behavioral Health maintains a diversion control plan. As part of this plan, there are several requirements that a patient with take-home privileges must follow. 1. All patients must pick up and store their medication in a locked container, generally referred to at the clinic as a lockbox. Each patient must have their own lockbox and cannot share a lockbox with another patient. 2. Patients must return all empty take-home bottles to the clinic on the next day of attendance. Nurses will check to make sure that you have returned the correct number of bottles and that the correct name and dates are on the bottles. Finally, patients with take-home doses will be subject to diversion callbacks. When you are called for a diversion callback, you must return to the clinic with your remaining take-home medication. Nurses will check the remaining doses to make sure the medication is being taken as prescribed. You will have 24 hours to return to the clinic once you are called. It is your responsibility to provide the clinic with a contact number, to notify the clinic if that contact number changes, and to notify the clinic if you will be traveling out of town. Throughout your treatment, you will be periodically tested for illicit substances. Results will be used to assess your medication and counseling needs. Objects such as jackets, purses, or bags will not be allowed in the restroom with you during a drug screen. Drug screens which are positive for illegal drugs or non-prescribed medication could result in the loss of some take-home dosing privileges. You will have the opportunity to regain privileges when you are no longer testing positive. Benzodiazepines are a class of medication often used in the treatment of anxiety. Benzodiazepines can cause sedation and can be addictive. When used with opioid medications like methadone and Suboxone, the sedative effects of benzodiazepines can become extremely dangerous, putting you at risk for potentially fatal overdose. Because of the high risks involved with benzodiazepine abuse, we take extreme caution with patients who are abusing or who are prescribed these medications. If you have a prescription for a benzodiazepine medication, you will be required to sign a release of information so that we can coordinate care with your physician. You will also be requested to present your medication for occasional pill counts. If you refuse to sign a release, or if you do not have a prescription, your dose may be reduced and you will not be eligible for take-home medication. Benzodiazepines are not the only medication that can be dangerous when taken with methadone or Suboxone. It is important that you inform the staff of any medications you are being prescribed. The use of alcohol while taking methadone or Suboxone can also be dangerous. With both methadone and Suboxone treatment, it is recommended that you do not drink alcohol. Let's take some time to review some of the other policies and rules that you should be aware of while you are in treatment. Threatening behavior, either verbal or physical, will not be tolerated at the clinic and may be cause for termination from treatment. The clinic does not use seclusion or restraint. Patients acting in a threatening manner will be asked to leave. Alcohol, illicit drugs, or weapons are not allowed in the clinic or on the premises. There is no smoking in the clinic. Patients are expected to wear appropriate dress while at the clinic. The medication and staff offices are off limits unless explicitly invited by staff. Loitering outside the clinic is not allowed. You must leave once your services are completed. Patients that attend the clinic with the appearance of being intoxicated will not be dosed and will be asked to leave with a safe ride. It is your responsibility to pay your treatment fees. All fees are due on Monday. Take-home doses must be paid for in advance. Ideally, your decision to leave treatment will be voluntary. However, certain circumstances may warrant an involuntary discharge from treatment and a referral to another agency or a higher level of care. The following are some potential circumstances that may result in an involuntary discharge from treatment: non-payment of treatment fees, violation of any law, threats of violence or acts of violence against staff or other patients, diversion of prescribed medication, theft or damage of property from the program, staff, or other patients, possession, attempted sale, sale or purchase of illicit substances on the premises, possession of weapons on the premises. A patient may also be referred if continued treatment is considered to be a danger to the patient's health. During your time in treatment with us, you will have some opportunity to provide us with feedback about your services. You can provide feedback informally by talking to your counselor. You can also provide feedback in writing at any time or through the contact form on our website, centerforbehavioralhealth.com. There will also be an opportunity to complete a patient satisfaction survey 2 times a year. We use the information from the surveys to evaluate the quality of the services we provide. If you ever have a complaint or a grievance that you feel was not adequately addressed through talking with your counselor, there is a formal grievance procedure that you may follow. The steps of the grievance procedure remain posted at the clinic at all times. We encourage you to be an advocate for your treatment and will not discriminate against any patient that files a grievance. It is our belief that all patients should be entitled to respect and to treatment without prejudice. In order to ensure this, we have outlined specific patient rights that the clinic abides by. Your rights were reviewed with you at your intake and will remain posted at the clinic at all times. A copy of your rights was also provided to you in your patient handbook and will be reviewed with you annually. Many of you may wonder how long you should expect to remain in the program. In general, patients that remain in treatment longer have better outcomes and greater long-term success. Withdrawing from medication too soon can result in a return to substance abuse. Patients who have achieved their treatment goals, have a sustained length of time in abstinence from illicit drugs, and who have adequate supports and stability have the greatest likelihood of success following a medically supervised withdrawal. Your counselor can help you to determine whether you might be ready to start a medically supervised withdrawal. After the completion of medication-assisted treatment, participation in a continuing care plan greatly increases your chances of success. Center for Behavioral Health offers continued counseling to patients who complete treatment. Questions you have about treatment that were not covered by this video may be available in your patient handbook or can be addressed by the staff at your location. Patient care is our #1 priority at Center for Behavioral Health. It is our goal to provide the best possible treatment to all those who need it. Thank you for allowing us to be a part of your journey towards recovery.